This week on Checkpoint.
He came with an injection, but the minute he pushed the medicine inside, my hand was burning. And I was screaming, asking him to stop, but he didn't stop.
Is there a proper theatre facility here at this clinic for you to perform operations at?
Questions about a Northwest doctor and his assistant after the deaths of 2 patients.
When I saw the hand, already I knew that time that she's gone.
This is Checkpoint, and I'm Nkepile Mabuse. We place our lives in the hands of medical professionals, often knowing little about them, whether they have mental health issues, are suffering from exhaustion, or if there are negligence cases against them. This we find out only after we have put ourselves or family members at risk. Health E! News has this report about a Potchefstroom doctor many have come to distrust. This is baby Mbali. Her father, Ntsikim Tuzulu, was besotted the moment he first laid eyes on her.
She's my Rose, so I'm going to call her Mbalendle.
And she was her mother Maggie's pride and joy.
And then like everything and I eat and you see like
They describe her as social, busy and inquisitive. Then in July, Mbali's curious nature got her into trouble.
The time ke tenela go godima stove ka go utla ngwana a gowa ne itse ngwana a gowa ngwana khanto phamotse kopi ya metsi a bedileng.
A neighbor helped rush mother and daughter to their local clinic in Ikageng in the northwest, where they live. Ntsiki joined them. Mbali spent 2 weeks at Potchefstroom Hospital recovering from her burns.
So I think a month or 2 months, she start develop another skin on top of that injury.
When I get trying, I was at all. Elke busigo, I do like a grahita or chesayan. Ki do like mo apote. Aingapa busuga na sa go bale.
When she's stretching herself, the blood's coming out.
Maggie took Mbali to a dermatologist at Potch Hospital.
So she came back, he told me, no, the doctor said you can't move this thing. It is a permanent skin.
A cousin suggested they consult a general practitioner in Ikageng, Dr. David Sello. Dr. Sello shares these rooms with his wife, who is a social worker. Mbali's parents say Dr. Sello was shown the dermatologist's prognosis.
Okay, he read that thing. He said, no, man, don't worry about this thing. He's lying. I can do this.
Abare ene ko hospital abetsi ntho ba ibuang. O tla entsha but big.
So I'm asking him, how much is it going to cost? He said, no, 3,000 rand. You're okay. But he said, no, I won't going to do this now. I'm going to do it, come back in January.
On the 5th of January this year, Maggie took Mbali to Dr. Sello for the procedure, a skin graft. They injected her with an anesthetic.
Gwa bitswa moshimane o tsamang le doctor o ko morago gore o butike kopa o tsoge o dula go diromo ko morago wa itse gore re na le motho tshantse re mo diro operation a tla moshimane o tlile setse doctor tlhabile ngwana ke injection tse pedi.
But it appears the anesthetic didn't work.
And then aba mo tlhaba ya boraro ngwana ba gana go robala.
Maggie says the third injection to sedate Mbali was given by this man, Dr. Sello's assistant, Mutlatsi. Mbali didn't lose consciousness. Bizarrely, Mutlatsi allegedly advised Maggie to leave, seemingly fearing for the child's life.
Habare ke tsameka ngwana before doctor e bona ngwana because o tlo batla go operate ngwana the way a leng ka teng. Ne?
This got Ntsiki asking questions.
Hey, I'm coming from the doctor. This child is not fine. She was weak and crying. I start getting worried. I asked her, this is a doctor. Because he told me everything. He eject the kid. So I'm start worrying, he's a reception.
Maggie didn't have the answer, and despite their reservations about Dr. Sello's practice, returned the following week for the skin graft.
After fetsa go tsena le ngwana mo ba etsa ngwana mo le ba itla ba mpha ngwana bone self ba mpha ngwana ba ema yana ba mpha ngwana itse ba fetsa go mpha ngwana ke na le dizzy ana le plaka mo tlhogong mona le khotone ka mogare.
This time, it appeared they got the dose of anesthetic correct. Mbali was out for the count.
Baba mo tsa gape sebakanyana ba elene go romo e ka mole. After ba tsena le ne mo e ka mole. Ke se tlhola go ditla ngwana alla. Ba feta gape ba feta. Ke ba botsa. A le feditse ka ngwana ke. Moshimana ba re re feditse ke be ke re ke tlo go motsa ba re ngwana ke ka go betse mo dim ga bete.
They said the child, still unconscious, could go home.
Maggie
trudged the 5 kilometers home.
She was very, very heavy.
Once home, she laid her child down. Later that afternoon, she became worried. Mbali had been asleep for hours.
Then from later, I was like, Mbali. I'm starting to be worried. They said he's gonna wake up. Nothing happened, not screaming, nothing.
She asked a neighbor to assist. The neighbor was convinced the child was dead, but Maggie didn't want to believe this.
Kenale cousin mo ngaka ko tlase ke mo dinono o dirile paramedic ka ke mmitsa ke mo grele mo kitchening ke mo gala ke re mwana go tlo go nthusa ngwana ke yo le kwa le tlhaga sejering itsa fitla mo o ile a mo dira mo sefube mona a mo etsana a mo tsenya phefo mo molomo like ka ba mo go nna sorry ha gona se sa tla setsang go setse go le late.
When I'm coming home, I saw the paramedic, police. When I saw the police, I told myself she's dead.
They arrived there at round about, it was 8 at night, according to the information to my disposal. And when they got there, the EMS personnel, emergency personnel, was already on the scene.
Northwest Police spokesperson Adele Myberg says police realized something was amiss.
It was noticed that there was actually stitches on the baby, and the mother mentioned that the baby went for an operation at a local doctor. So then the police immediately contacted the people from the Department of Health, and the body was removed to the mortuary, and an inquest case was opened that night.
That's normal when there's a death after an anesthetic, says Dr. Kgosiletlape of the Health Professions Council of South Africa.
Well, a death in theatre on the table, or a death within 24 hours, would be considered an anesthetic death, and an inquest is mandatory.
The HPCSA regulates and registers doctors in the country, ensuring that they behave in an ethical manner and in the best interests of the public. Dr. Letlape says they are investigating Mbali's death. The police are awaiting final post-mortem results. But Dr. Letlape is clear that Mbali's procedure should not have been done in a doctor's rooms.
If you're basically asking me whether people can do skin grafts in their side rooms, the answer is no. A skin graft is an extensive procedure. There could be blood loss, you could lose the skin. You need sterile conditions to conduct proper skin grafts. So I think in general, skin grafts would be done in a fully equipped theatre.
And most worrying is why the child was sent home while she was still unconscious.
You must be fully awake, breathing on your own, before you could be sent home.
When I ask questions, I feel the child was already dead to the surgery. So they are making her stupid to give her a child, but they know the child is dead.
When we return, another alleged victim of Dr. Sello of Ikageng.
When I saw the hand, already I knew that time that she's gone.
An internet search for Dr. David Sello states that he works as a general health practitioner in Ikageng, near Potchefstroom in the Northwest Province. But ask around the area and you'll find out much more, as Health E News did. We did some asking around in Ikageng, where Dr. David Sello practices, and soon found the family of the late Polina Kwena.
My father wasn't there for me, so I grew up with my mother only.
She was a very peaceful person.
Like many people in their 70s, Polina had health issues.
She had hypertension. She was suffering from diabetes. She was asthmatic.
Polina's high blood pressure caused a fluid buildup in her lower legs. In 2016, Sarah took her to Dr. Sello's rooms to treat her swollen legs.
He just injected her on the back when my grandmother was laying there, and he went out of the consulting room, the doctor, because he was arguing with one of the employees.
Sarah went in to check on her granny.
I said, "Granny, are you okay?" She said, "No, just call me the doctor because now I cannot breathe." Then I ran quickly to the doctor and told the doctor, "Doctor, my grandmother, she can't breathe." The doctor, he was busy arguing with that one of the employees. He didn't act immediately.
Anxious and upset, Sarah called her family. Matapelo rushed to the rooms.
Sarah was still outside the surgery. She was crying, and I asked her, "Sarah, what's going on?" She was like, "No, they're not saying anything. Maybe you guys can go in because I don't want to even go inside anymore." When we got there, Dr. Sello went out of that room, and then Mahlatsi followed him. But when they leave that room, they closing the room. We shouldn't go inside. And I asked that guy, "Mahlatsi, what's going on? What's happening? Is my mother okay?" And then he was like, the face was so scary. He looked so scared and confused.
Matapelo went in to see what was going on.
And then my mother was lying on the bed, and then the hand was like this. When I saw the hand, already I knew that time that she's gone.
And he's never shown any remorse.
The family says Polina's legs were slashed, presumably by Dr. Sello and Motlatsi. Dr. Khosile Tlape of HPCSA says fluid buildup cannot be reduced in this way.
Slashing legs would not be part of the treatment.
Sarah called the rest of the family to the surgery, and chaos erupted. The police were called and arrived at the surgery.
It was something like a movie.
He said, "Naglon, you can take me to the papers. I don't care. I will contest against you. You'll never win this case."
Even somebody from the police officers was even saying, "You must be very careful. Dr. Sello has got lawyers, and you must be sure if you say you are opening a case, he's gonna sue you."
2 years since Polina's death, Dr. Sello has offered no explanation as to what happened behind his closed doors on that day.
He never even came to our house. He only just said to my brother, "No, I'll come during the week. I'll sit down with you. We'll talk about this." He never. Sometimes I even see him, maybe at campus or anywhere in town. He's okay. He can live with whatever that he got away with.
Next up, we go in search of Dr. David Sello and his assistant, Motlatsi.
We had to deal with the story of that baby in Bali and what happened to her. I believe you were present during that operation.
Getting a doctor investigated and struck from the medical role is a lengthy process, during which time he or she may continue practicing. The HPCSA is investigating Dr. David Sello from Ikageng in the northwest. But in the meantime, his surgery doors are open. Health E! News paid him a visit. In 2015, Dr. David Sello paid an out-of-court settlement of 500,000 to an Ikageng resident. She went to see the doctor after experiencing a panic attack, but lost the tip of her finger after a procedure in his rooms. She wants to remain anonymous.
He came with an injection, but the minute he pushed the medicine inside, my hand was burning. And I was screaming, asking him to stop, but he didn't stop. And my right finger, it started becoming blue. But when I woke up the following day, my hand was very swollen. Around November the 22nd, they amputated me.
The Health Professions Council says this case will also form part of the investigation into Dr. Sello.
By law, we have to look at each case individually. If we found that the case was similar, you could be charged with 1, 2, 3, 4 counts. But each one, by law, would have to be thoroughly investigated, because the issue of there being a pattern would be dealt with differently.
Little Mbali's father, Ntsiki Mthuzulu, has learned that Dr. Sello has been treated at the Witwatersrand Psychiatric Hospital in Potch. A source at the hospital confirmed to us that he had been treated for a bipolar disorder.
Someone tell me he was in Witwatersrand, I think last year, and he came Witwatersrand again. It's not the first time about this.
The HPCSA has clear protocols in issues like this. They have to be informed of practicing doctors' psychiatric disorders.
We have a health committee where most people that have issues with fitness to practice would be referred to, whether it's mental illness, whether it's physical disability, whether it's substance abuse, or anything that may interfere with your ability to continue practicing competently.
Witwatersrand would not confirm or deny that Dr. Sello had been treated there, citing patient confidentiality. We decided it was time to meet Dr. Sello. Patients and staff were saying morning prayers as we walked in. First, we spotted Mutlatsi, Dr. Sello's assistant. We wanted to know what had happened to baby Mbali and if he was a trained nurse.
We had to deal with the story about baby Mbali and what happened to her. I believe you were present during that operation.
You know what, I'm not going to comment on that.
Do you realize that the baby died during the course of it?
I'm not going to comment on that. I think the relevant person to speak to is Dr. Sello.
Are you a trained medical practitioner?
No.
You haven't got any training? So why are you injecting babies?
Did I inject the baby?
Apparently
Who
so.
told you so?
This is what we heard from the mother's baby. The mother of the baby.
I'm not going to comment on that, I'm sorry.
The Health Professions Council says if proven that Mutlatsi was assisting Dr. Sello in more than an admin function, it's a serious violation.
In terms of the laws of the country, only registered professionals are allowed to touch a patient and work on a patient. You cannot use somebody that is not registered.
At Dr. Sello's rooms, the office manager, who introduced himself as Mike, made an appearance.
So now can you just switch off your camera so I speak to the doctor if we can see you about that.
We did. Requested an interview and 15 minutes later was shown to Dr. Sello's rooms. But he had nothing to say.
So we want to offer you a right to apply.
But like you don't want anything.
Yeah, I can So was one fella, you know, commenting. So I told the man,
Any of them.
We decided to put some questions to him regardless.
Is there a proper theatre facility here at this clinic for you to perform operations at? Do you have proper medical staff, trained medical staff, helping you with those procedures that you're performing in your surgery?
He sat staring throughout. We asked him about having been admitted to a psychiatric hospital.
We believe that you have been an inpatient at Veteran Psychiatric Hospital here in Potchefstroom. Is that true? We believe that that was linked to a bipolar disorder. Would you like to comment?
No comment on all of the above questions.
And with that, we left.
All right, thank you very much for your time.
If the HPCSA inquiry goes ahead, Dr. Sello won't be able to sit in silence. And if Motlatsi has no medical training, there could be serious repercussions.
So we would have what we call a suspension hearing, a panel, and put to the practitioner to give reasons why they should not be suspended. Because a person that operates in that manner is a serious threat to public safety.
Maggie and Ziggy are still battling to come to terms with what happened to little Mbali.
Everywhere go yang teng ba go botsa go ngwana go kae tlholo mo pepile. A ke itse ke arabe ka go nkosa. A sa le yone ka tlhola ke be ke mmo. Nna ke batla go doctor e ba kwale surgery for se sa etsagala mo batsading ba bang cause gona re le batsadi re lwanela bana ba gona bophelo. Oh. Nene ntongwe le mo gone. Ke fitse le go ke tlogele mosebetsi ke kgone go ikhulisetsa eng cause ke mmono go ne le ngwana siame.
After our interview with the HPCSA, they visited Potchefstroom for a public awareness campaign. Among the topics, the rights of a patient and lodging complaints with the HPCSA. Maggie, Nziki and Stella attended.
I'm happy that myself and the others who attended now know how to screen the doctors, how to lay complaints.
Jaka yaanong e tlhagileng lefapha le tlile mona ke kopa bagolo ba rona ba bule ditsebe ba nne ba shebe dilo tse di tshwanang le tse gore ga ba ya ko dingakeng ba ske ba ya ka go fatlhega ba ye ba butse matlho a bona.
Checkpoint drove past Dr. Sello's surgery after the HPCSA meeting. It was business as usual. That's all from us this week. Please do give us your feedback. Our Twitter handle is @checkpoint_ENCA and our email address checkpoint@enca.com. Thanks for watching. I'm Ngepile Mabuse.